What advice would you give to NHS and health and social care service professionals wondering how they could maybe change their approach?
It's absolutely crucial, vital, that you teach and educate them in awareness. This would help those NHS professionals to be able to confidently approach and interact with both deaf and deafblind people. They also need to be taught about using interpreters so that they understand the dynamic of the three-way relationship between the patient, doctor and interpreter. This is really important. I remember one bad experience that particularly affected me. It happened recently when I went for an ear. Well, I have problems with ear infections, so I went to the hospital. The nurse was great. They seemed aware that they needed to tap me gently on my hand in order to initiate conversation, which they did. I was with both my guide and an interpreter, so everything was great. Once we moved to the cubicle, I needed to lay on the bed so that the nurse could check what was going on with my ear. On observation, they realised that due to the nature of the problem, they would need to bring in the doctor. I was fine with that and waited for them to arrive. The doctor arrived and came towards me to check me over. Now I need hands-on sign language interpretation, but the doctor actually pushed my guide and hands-on interpreter away. He pushed them back. I was surprised. He then attempted to communicate by shouting at me whilst manhandling and manipulating my body as if I were a rag doll. I was shocked. I couldn't believe it. I'm still a human being, even though I use hands-on sign language for communication to enable me to understand the information being given by the doctor. But he ordered them to leave. I was so disappointed. That's why it's important to educate staff and provide awareness training so that they know what they need to do when they come across someone who is deaf or deafblind. Then they'd be equipped to meet the needs of the individual. Even before I lost my vision, some doctors didn't have the patience they needed. They were always in a rush and became easily frustrated. This left me at a disadvantage. It's not appropriate that I should be made to feel that way. I think they're like that because they lack confidence and panic. But this has an effect on my ability to relay information to them about whatever medical issue I'm having. It puts up a barrier or a wall between us. A lot of deaf people, like me, pick up on subtle body language being exhibited. We can recognise when someone's panicking. So first and foremost, we need to raise awareness in staff so that they are confident in these settings and can proceed calmly. That would be good. The second issue that needs to be addressed is how to work with an interpreter. Never, 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 this is important, never say to the interpreter, "Can you ask Debra to tell me what the problem is?" Don't do it, just don't do it. The doctor should speak directly to me, like, "Hello, so what seems to be the problem?" Straight to me. Don't ask the interpreter to ask me. Don't do that, ever.